Have you ever been sitting at work, cooking, or simply resting, and suddenly felt a tight, heavy sensation in your chest? Like an invisible hand squeezing your chest, making every breath difficult, forcing you to stop, breathe more slowly, and wonder, what is happening to me? The feeling isn't exactly sharp pain, but it is very uncomfortable, making you tired and anxious. Many middle-aged people describe this sensation with familiar phrases. My chest feels like it's being squeezed. I can't breathe deeply, it feels heavy. It's not exactly painful, but very pressuring, tiring and unsettling. In middle age, chest tightness is no longer a rare occurrence. In fact, it happens so frequently that many people are complacent, thinking it is just due to fatigue, stress, or simply sitting in the wrong posture. However, behind these episodes of chest tightness, there may be many serious health issues, especially cardiovascular, pulmonary, neurological, and digestive diseases. So why is chest tightness common in middle age? When is it a dangerous sign that requires immediate medical attention? And are there any exercises that can quickly relieve chest tightness and are easy to do on the spot? Let's explore these questions in detail and listen to the language of our body. First of all, we need to understand that chest tightness is a diverse symptom that can come from many different causes. To identify and handle it correctly, let's review the common culprits that make middle-aged people prone to chest tightness. First of all, it is impossible not to mention cardiovascular disease, the leading culprit of chest pain in middle age. When entering the age of 40 to 50, the vascular system and heart begin to age. The process of plaque buildup in the arteries gradually reduces the blood flow to the heart, leading to angina, also known as chest pain. In particular, coronary artery disease is very common in middle-aged people when the arteries narrow, causing the heart to work harder, resulting in a tight chest sensation, especially during exertion, such as climbing stairs, walking fast, or even just after eating. Hypertension is also a cause, as prolonged high blood pressure forces the heart to constantly strain, creating a feeling of tightness in the chest. Additionally, arrhythmia, whether the heart beats too fast, too slow, or irregularly, causes uneven blood pumping through the heart, also creating discomfort, palpitations, and even chest pain. You need to be especially alert if chest pain spreads to the shoulder, neck, jaw, or down the left arm, accompanied by signs such as shortness of breath, cold sweat, dizziness, or occurring even when you are at rest. These could be warning signs of a heart attack or dangerous cardiovascular events, requiring emergency treatment within the golden time, the first 1 to 2 hours to preserve life. In addition to cardiovascular issues, stress, anxiety, and anxiety disorder syndrome are also common causes of chest tightness in middle-aged people. Modern life, with pressures from work, family, and finances, causes the sympathetic nervous system to be continuously active, leading the chest muscles and diaphragm to tend to contract, causing a feeling of tightness and difficulty breathing. Many people describe that whenever they feel worried or stressed, their chest feels heavy, their heart races, it is hard to take a deep breath, and only when they calm down does the discomfort gradually decrease. Chest tightness caused by stress and anxiety can last for hours or even the whole day, significantly reducing quality of life. A commonly overlooked but quite prevalent cause is lung diseases. Pneumonia, chronic bronchitis, adult asthma, chronic obstructive pulmonary disease, COPD, due to long-term smoking, or pneumothorax, although rare but extremely dangerous, can all cause chest tightness. The distinguishing features include chest tightness accompanied by persistent cough, difficulty breathing when lying down, pain when taking a deep breath, or even cyanosis of the lips and fingertips. In particular, gastroesophageal reflux disease, GERD, is also a cause that is easily mistaken. Few people think that stomach acid refluxing into the esophagus can cause a burning sensation and tightness behind the sternum, especially after eating a full meal, lying down immediately after eating, or at night. The chest pain caused by reflux often has no clear cause, appears suddenly, and causes anxiety for the patient. In addition to the aforementioned diseases, posture and lifestyle also significantly contribute to chest tightness. Sitting with a hunched back for a long time, bending forward, and lack of exercise causes the chest and upper back muscles to become tense, reducing the ability to take deep breaths and causing a feeling of chest pressure. Furthermore, habits such as smoking, drinking alcohol, and eating a lot of fatty foods increase the risk of cardiovascular and respiratory diseases, making chest tightness occur more frequently. Thus, chest tightness in middle age is a diverse symptom that can come from many different causes. However, chest tightness is not always a dangerous sign. So when do you need to see a doctor immediately? If you feel chest tightness accompanied by the following symptoms: pain spreading to the neck, shoulder, jaw, or down the arm, cold sweat, nausea, dizziness, severe shortness of breath, bluish lips or fingertips, or sudden onset without a clear cause, go to a medical facility immediately. These may be signs of a heart attack, myocardial infarction, or pulmonary embolism, requiring emergency treatment to prevent serious complications. However, if the feeling of chest tightness is mild, occurring when you are stressed, tired, or sitting in the wrong posture, you can try a simple breathing exercise combined with muscle relaxation, which helps reduce chest tightness in just a few minutes and is recommended by doctors for immediate use. This exercise consists of 2 parts: deep breathing with a 4-4-6 rhythm and chest-shoulder muscle relaxation stretches. When performing it, you will clearly feel the increased oxygen intake into the lungs, the chest and shoulder muscles relaxing, the heart rate slowing down, reduced nervous tension, and the sensation of chest tightness easing. First, choose a preparatory posture. Sit up straight or stand. Relax your shoulders, place both feet on the ground, keep your head straight and gaze gently downward. Then, begin the deep breathing exercise, a 4-4-6 rhythm. Inhale through your nose for 4 seconds, feeling your chest and abdomen expand. Hold your breath for 4 seconds to allow oxygen to deeply absorb into your blood. Exhale through your mouth for 6 seconds, slowly and evenly, feeling your chest gradually deflate. Repeat this movement 5 to 7 times. Next, move on to the chest opening stretch. Interlace your hands behind your back, palms facing each other. Take a deep breath, push your chest forward, pull your shoulders back, and hold for 5 seconds. Exhale and completely relax. Repeat this movement 5 times. Finally, bend forward and relax. Sit or stand. Bend forward, relax your shoulders and arms, and breathe gently 3-5 times. After just 2 to 3 minutes of doing this exercise, you will feel your chest noticeably lighter if the cause is muscle tension, stress, or shallow breathing. Along with immediate chest pain relief, maintaining a healthy daily lifestyle is the best way to keep the chest light and the heart and lungs always healthy. Spend 20 to 30 minutes each day doing aerobic exercises such as walking, swimming, or cycling. These are natural tonics for the heart and lungs. In your diet, reduce salt, limit animal fats, and increase green vegetables, fish, and heart-healthy nuts. Absolutely avoid tobacco, limit alcohol and stimulants. Especially pay attention to stress management through meditation, yoga, deep breathing, or journaling to release the negative emotions. Don't forget to have regular health checkups every 6 to 12 months to detect potential cardiovascular and respiratory diseases early. Finally, listen to the voice of your body. Chest tightness in middle age is not always dangerous. Sometimes it is just the result of stress, poor posture, or lack of exercise. But there are also times when it is a serious warning from the heart, lungs, or digestive system. Never take abnormal symptoms lightly, especially when they are accompanied by dangerous signs, as mentioned above. Remember, if chest tightness is accompanied by pain radiating to the shoulder, neck, jaw, or down the arm, cold sweat, dizziness, or severe shortness of breath, seek medical attention immediately. If it is just mild chest tightness due to muscle strain or anxiety, try the 4-4-6 chest opening breathing exercise combined with muscle relaxation to feel immediate relief. And most importantly, maintain a healthy lifestyle and take good care of your heart and lungs, the two most important engines of life. Keep your heart healthy, breathe deeply and gently. You will stay youthful longer, enjoy every moment to the fullest, and no longer worry about sudden chest pains. Love your body, listen to every small signal to protect your health every day. That is the secret to living happily and healthily in middle age, the age of experience, maturity, and happiness.